Okay, so my critical appraisal was on radiography and tibia and fibula fractures. So the article that I chose is comparing CT scan, which is the gold standard, to X-rays for posterior malleolus fractures. So my search strategy was just through PubMed, looking for articles that were in English and within the last 10 years. The search terms that I put in were just copy and pasted below, so just radiography, tibia fracture, and then your sensitivity and specificity. I got 882 results from that and found an article that I cited on my last page that I'm going to use also. That one I read through and found the article that I chose in the references for that article. So the objective for my article is a preoperative CT scan could improve the diagnosis and management of posterior malleolus fractures as opposed to X-ray only. So for my patients, they were operated for a bimalleolar fracture between November 1st of 2018 and May 31st of 2020 in this hospital. The intervention was radiological analyses were carried out by two trained independent surgeons to diagnose tibia fractures and assess fracture characteristics. The comparison was radiography versus gold standard, which is your CT scan. And then the primary objective was radiography accuracies compared to a CT scan. And the secondary one was your intra-observer and inter-observers agreement. Those were compared as well. Study design and level of evidence. So is a level of evidence 3, and study design is a mono retrospective cohort study. For the patients, there were 60 patients with a mean age of 50 years old. There were slightly more men than women, so there's 43 out of 60 uh, women of this study, and the rest of them were men. Inclusion criteria just had to be a patient operated for a bimalleolar fracture between those dates, and they were admitted from the emergency department, and they had to have a CT scan and an X-ray before surgery. Exclusion criteria were patients under age of 15 and have pylon fractures. Those were excluded as well. The other one, there were 10 patients that were lacking a CT scan before surgery, so those weren't included either. For the methods for this study, of the 60 patients that were operated on, again, primary outcome was comparison of X-ray and CT scan. Every patient in the ED with a suspected fracture got 3 X-ray images, and those are listed below. After that, if they determined that they had a bimalleolar fracture, they were immobilized and then sent to have a CT scan. Once that CT scan happened, the two trained independent surgeons were examined the CT scans and the X-rays. They were blinded of the patient's demographics and read it directly after those were taken, and then performed another analysis on the images 6 weeks after just to get that comparison. So diagnostic values are below. Sensitivity is not super great, but the specificity is really good. So basically, if they had a fracture show up on the X-ray, they definitely had a fracture. But if they did not have a fracture show up on the X-ray, doesn't mean 100% that they did not have X-ray. There was still that possibility that they were missing something. And then here's that diagnostic accuracy for that. The specificity for the X-ray and CT were all very high. The second study that's listed is the one where I found the one that I chose to use. This is in the references for it. They also compared CT of awareness versus no awareness, and then the first one's just the combination of those, just the overall numbers for your sensitivity, specificity, and likelihood ratios. So the results of the study that I had, out of the 60, posterior fragments were found in 35 of the 60 cases on X-rays, but then in CT scan, it was 53 of the 60. So the CT scan helped surgeons diagnose 30% more posterior malleolus fractures. And then for their secondary objectives, the intro observer reproducibility was rated moderate for X-rays and then excellent for CTs. And then intra observer reproducibility was rated low for X-rays and then moderate for CTs. So for inter and intra, rater reliability was better for CT scans. And this is my Quadis. I gave it at 11 out of 12. And then take home points, CT found 30% more fractures that radiographs miss. They both had very high specificity, but I just noted the difference between them being blinded versus not blinded in the CT, that the awareness group kind of drug down the overall numbers just a little bit. And for the initial study, out of there were 5 patients that surgeons said that the CT radically changed the way that they had their surgical strategy planned out. And then even though CT and X-ray have close specificity, CT gives better detail, more information to diagnose posterior malleolar fractures, which is how we came to the conclusion of the 2 points above in those articles, that there were fractures that were missed on CT and that there was better ability to plan surgery through having a CT as well. And then there are my references.